thank you so much, Halla. I think you squeezed me in. I think that's actually what's happened here. I'm so sorry that this didn't quite go as planned, but that's the nature of politics, with sort of last minute things. And I'm so glad that you've sort of done this really important report. I think obviously I have experience with MAP, and I've been in the region. I know the incredible work that MAP do. And some of the things that I saw even before the pandemic, things like, you know, young fathers not getting the cancer treatment they needed in a timely way and dying, young babies being separated from their mothers just after the mothers have given birth, and the mums not being allowed to be with them. The inhumane treatment of the Palestinians is something that would affect any frontline health workers' mental health at the best of times. And I know it certainly affected mine in the sort of last 12 years that I've been working with the Palestinians across the Middle East. But all of this is before COVID hit. And I actually really I am in awe. I'm in absolute awe of everybody working on the front line from MAP and other professionals that you work with when you're there, because I honestly don't know how you did it. Working on the front line in England, which had its own struggles, but is very developed, without such a divided system as to who's allowed healthcare and who isn't, it was hard enough. So I can't even imagine the toll that the sort of pandemic would have had on your mental health. And I think it's just really important that we remember as well, and I know that this doesn't often make me flavour du jour, but that the other additional crises that have faced Palestinian communities has added just an extra wound that has been almost impossible to bear, considering the pandemic and the original state of the situation for Palestinians in Israel and Gaza. So I just thank you very much for having me today for the short time that I'm able to be here. I'm so sorry I wasn't able to chair the event, but I'm sure you've had a phenomenal discussion, and I can see friends on here like Asal Khan. I can see his smiley face there in the corner, and I know that though it might feel like a very lonely space sometimes, just know that you have friends and colleagues and people thinking of you all the way over here and fighting as hard as we can to have your voices heard. And the report strengthens our ability to do that as well, because it gives us more evidence which we can present. So thank you very, very much for all that you do, and know that I will be a lifelong supporter and friend of MAP. Thank you.